But let's go back to that co-creation process. And allow me to invite first the mayor of Banjul in the Gambia, Mayor Rohey Malick Lowe, a very challenging city that you have, but also a very strong link with communities. The floor is yours, Mayor, for a presentation of about 5 minutes. Welcome, thank you for joining us.
Thank you very much, Emilia, and thank you to all my colleagues also. I'm saying good morning, good evening, good afternoon to all of you. I want to make my slums and of course mobility. But let me first and foremost say that so far in the Gambia, we have 11 confirmed cases and 1 death. There is no single case in my city, and that's a very good news. But what we did was a massive sensitization and urged the community to take ownership. And we involved the CSOs and the religious leaders to take to be at the forefront. So this has also helped us a lot. But looking at it in the perspective of women and the economy, let me first say that in the Gambia and in most countries, local governments are the first responders and play a very important role in protecting lives. Here in Banjul, the municipality has made sure that women and children are highly protected, knowing their vulnerability. In the informal sector, let me highlight the housekeepers, or better say the maids. In the Gambia, we have what we call maids. There's housekeepers, and normally they live in houses where they're working. For them, sick means becoming sick means becoming more poorer. They will not get paid, of course, if they are sick because they cannot come to work. And this is simply because the nature of their job don't allow them to work outside the home. So this is obvious that if they are sick, it means automatically that they are kicked out of their job. So other women also are hotel workers and have to lose their jobs simply because hotels are not operating now in the Gambia. Gambia is a tourist center, but during the COVID-19, definitely it has really hit Gambia very badly. When we talk about slums, colleagues here, in Banjul, I have a place that we call Tobacco Road, and is basically can be categorized as a slum. So because of the overcrowding there, women and youth suffered the most, and the risk of them infected is 50% higher. So, but thank God, as I said, even though we have the slums there, because we implemented the policy which says the communities should be take ownership and ask the religious leaders and the CSOs taking lead in this. Even though we have the slums, but we don't have a case in the city. We will all agree that in the slums, the social distancing is impossible, and the poor sanitation is also a factor. But again, before Gambia has a case, we already heard about this. I already heard about the coronavirus when I was in Abu Dhabi. This is where I had this coronavirus. When I didn't see my colleagues from China, then I start asking, what happened, what happened? This is where I understand that there was something called coronavirus. So I came with that from Abu Dhabi to my city, and then we start tightening up our belts. So I called the community straight away, community leaders, the CSOs, the Red Cross, and said, look, this is what I brought from Abu Dhabi, and I am sure very soon we will hear the whole world crying out of this virus. So this is how we started, and we tightened our belts. We did what we were supposed to do. That is the sensitization. And when the WHO declared this as a pandemic, Banjul was already far ahead. So again, when we talk about mobility, everybody knows about the informal mobility in Africa, and Banjul is no exception. But we were able to control the cars by pressing government to at least reduce the prices of fuel which they did, even though much was not reduced from the prices, but we were able, due to our aggressive sensitization, we came also to have understanding with the drivers to make sure that instead of having 10 in your car now, you will have 5. And that is working absolutely well. In the slums also, we were able to give them tanks through the National Water Agency. We were able to quickly get big tanks of waters to put it in the slums. And basically, there are a lot of things that we have done using also the platform of REFELA, where women came out aggressively also to take ownership. So we have involved women, and we also, the REFELA now, we have also another chapter that is the he-she REFELA. This also we have brought it in during the COVID-19 to make sure also we have our partners as men to come in also and help us. So REFELA also, Emilia, let me also take this opportunity to tell you that REFELA also is doing extremely well in this COVID-19. Women are going out in the markets where, if I talk about women and the economy, of course, the markets will take a center stage in Gambia, because this is where the women are selling their things that they farm, and this is where women are selling goods every day to earn living. So this is where also REFELA has played a very important role, and REFELA has gone viral in the Gambia now, and thank also to COVID-19 that has made REFELA also gone very viral, because they are doing a very good job taking lead in the sensitization. Even though we have the CSOs, we are working hand in glove with them. So far so good in Banjul. We have, as I said, we have 11 confirmed cases in Banjul in Gambia and 1 death, but we didn't have any cases in Banjul. I thank God. And my only problem now and my only worry is post COVID-19. That is in the context of the women and youth, especially when we talk about women in the economy. Thank you very much.
Thank you very much, Mayor, for bringing this perspective, also a strong perspective on gender. We are all very concerned, and in fact, next week we will be talking about gender equality and the risk that we are running to go backwards, actually, in our fight for gender equality. It is true that a lot of the jobs and the economies and the realities that women move in are very fragile, and this crisis is making it even more obvious and is putting many women in a difficult position. And we also think that the leadership of women like yourself might make us more aware of the challenges that this group is going through. So thank you for bringing that perspective, and congratulations on not having a very big sanitary crisis yet there. We wish you well. It's certainly not the case over here yet. We are just starting to overcome it slowly. Allow me now to go to another continent. Similar challenges, a different reality. Bienvenido, Jesús Darío González Bolaños, Secretary of the Municipality of Santiago de Cali, and also the manager of the Municipal Services Enterprise of Santiago de Cali. So a public endeavor from Cali with a perspective on this pandemic and what you are trying to do. Le invito a que tome la palabra, señor. Tiene 5 minutos. Le aviso cuando tenga que ir terminando. Muchas gracias.
Cordial saludo para todas y todos. Sí, mi nombre es Jesús González, soy secretario de Gobierno de Cali y además gerencio la empresa de servicios públicos de la ciudad que aborda los servicios de agua, de acueducto, de alcantarillado y telecomunicaciones. Un saludo, es un alcalde Iván Ospina Gómez, un médico saludista que hoy lidera la ciudad. Y sé que en la conversación que queremos tener está alrededor de la vulnerabilidad. Nuestra colega ahora ha mencionado un énfasis particular asociado al asunto de género. Yo voy a referir brevemente que lleva el manejo del COVID-19, un asunto muy asociado con las circunstancias de vulnerabilidad en relación con nuestra población informal y situada en asentamientos populares de desarrollo incompleto. Debo decirles que Cali es la segunda, tercera ciudad del país, que tiene 2.300.000 habitantes aproximadamente, y que a la fecha tenemos, respecto al COVID, 196 personas que han sido identificadas. Tenemos lamentablemente 42 personas que han fallecido, que han muerto, y tenemos 123 personas que hemos logrado recuperar. Esto es una curva baja. Sin embargo, respecto al conjunto del país, al país urbano en Colombia, la red de ciudades, Cali es una de las ciudades más vulnerables, porque queda al suroccidente de Colombia y tiene conexiones con un ámbito internacional, tanto con Ecuador como con Panamá. Además, nuestras familias, una de las principales actividades económicas que hay en Cali, que es un puerto seco, está muy cerca al puerto de Buenaventura que conecta con el Pacífico, es las remesas que llegan de afuera. La ciudad es muy dependiente de las remesas que hay afuera. Y un rasgo particular, que es el que voy a marcar, está asociado con que la economía de la ciudad es casi un poco más del 50% de economía informal. No hay puestos de empleo formales ligados a la gran industria, sino que es una economía de servicios informales. Se suma a esta situación el hecho de que es la informalidad en la espacialidad, en la geografía urbana, está conectada con una territorialización muy marcada en el oriente y el occidente. El oriente de la ciudad es ladera, es una zona andina popular. Y el occidente y el oriente, perdón, es una parte de ciudad popular de carácter afro, muy conectada con la cultura de los ríos. Sobre eso, entonces, voy a decirles cuáles, digamos, brevemente nuestros aprendizajes y nuestra primera etapa. Recordando una cosa que es muy importante, y es que en Colombia las medidas frente al COVID han sido muy centralizadas por el gobierno nacional. Las grandes capitales hemos tenido un protagonismo, como ahora se mencionaba, sobre todo en cómo manejamos la relación con la población y cómo manejamos la relación con una perspectiva más comunitaria y más de salud comunitaria. Entonces nosotros tuvimos en enero, tuvimos una ventaja y es que nosotros alcanzamos a ver los reflejos de lo que pasaba en Asia y en Europa y tuvimos alguna posibilidad como país, estrategia país de prepararnos. Cali, nuestra ciudad, hizo una primera etapa en enero, febrero, que le llamamos la vacuna está en tus manos. La vacuna está en tus manos busca posicionar una relación de corresponsabilidad, parte de la idea del lavado de manos, pero también trasciende a que está en tus manos porque está en tus decisiones, está en la posibilidad de activar una gobernanza y generar una transformación de un problema en una actitud. Lo que hemos buscado en esa primera etapa es que la población no se preocupe, sino que se ocupe. No nos quedemos quietas, sino que actuemos. Eso nos ha permitido hacer algo que es muy importante en términos de estos sectores vulnerables que tienen una cultura popular muy enriquecedora y muy rica, pero también muy fácilmente afectable por los miedos. Ha sido reconocer que el fenómeno existe, que no es juego, que todos tenemos una corresponsabilidad y preparar a la ciudadanía para tomar medidas. En esto todavía estamos, pero creo que un logro importante ha sido trabajar en relación con nuestras comunidades afro, indígenas, campesinas, venidas a la ciudad en asentamientos de desarrollo incompleto, en condiciones de hacinamiento y con otros trabajos informales. Nos hemos tratado de preparar para que sean las comunidades y nuestra cultura local la que de alguna forma también reaccionen proactivamente. Y esto lo hemos hecho no solo con comunicación, sino entregando pasabocas, entregando guantes, entregando insumos básicos de lo que intuitivamente observábamos. Primera fase, La segunda fase está acompañada por una medida que se toma a mediados de marzo por el gobierno nacional, que le hemos denominado una cuarentena, que es el clásico fenómeno del aislamiento. En ello estamos todavía hasta el 11 de mayo, y ese aislamiento nosotros lo hemos puesto con un título grande que es Quédate en casa. Quédate en casa es una forma de concretar una estrategia que tiene 5 ejes. Las medidas de salud, prevención y fortalecimiento del sistema de emergencia en el manejo de COVID, todos los temas salubristas y epidemiológicos y de territorialización de medidas a nivel local. El tema de seguridad alimentaria, porque en la medida en que la población se quede en casa y no tiene recursos para el sostenimiento, se requiere unos ejercicios de solidaridad y de apoyo del Estado. Entonces hemos trabajado ollas comunitarias, no comedores porque se genera aglutinamiento, sino ollas en las cuales se fabrica comida y se circula de formas escalonadas para que las personas tengan alimento. Hemos generado solidaridades para que el mercado se comparta. Hemos trabajado estrategias a nivel de seguridad alimentaria. Hemos trabajado temas de seguridad ciudadana en el sentido de que las redes de vecinos puedan configurarse en forma de tener un nivel de autocontrol y autorregulación en estos territorios. No es fácil porque Cali es musical, es festiva, es una cultura de fiesta y de un arraigo profundo. El concepto de arraigo está metido en nosotros. Y entonces hemos tenido que trabajar muy fuerte ahí y hemos debido también tratar de comenzar a impactar una cultura del trabajo informal en la calle, a encontrar actividades, pues lento, que las familias y los trabajadores puedan hacer en casa y a encontrar formas de domicilio popular que no haga, porque es muy fácil que las grandes infraestructuras y plataformas de producción y consumo se mantengan porque tienen una estructura formal y lo han hecho
Un
con
minuto
restricción.
para terminar, por favor,
Perfecto.
secretario.
Sí. Pero con lo informal hemos tenido que trabajar. Esto va cerrado en esta etapa en la conformación de unas comisiones por la vida y la seguridad y la solidaridad en territorios. Hemos territorializado la política. Y hoy, para cerrar, estamos en una política que yo le llamaría saca tu pasaporte sanitario, porque nos estamos preparando para una reactivación parcial de la economía y estamos concentrados ahora en un trabajo de cultura ciudadana, de cultura cotidiana, para trabajar bioseguridad, trabajo seguro, salud integral. Y esto pasa por la necesidad de reinventar pues, la vida en la ciudad, reinventar las políticas y reinventar las maneras de trabajar. Tendría muchos ejemplos en ello, pero creo que se ha cumplido el tiempo. Muchas gracias.
Muchas gracias, secretario, y gracias por traer efectivamente un tema que es muy importante aquí también y que es esa vida cultural y esa realidad cultural que tenemos que manejar y que es distinta en cada ciudad, pero que es parte, que tiene que ser parte de la fórmula de la solución. Muchísimas gracias. Let me go now back to Africa, and I would like to invite the president of the of our Federation of Local Elected Women there, of REFELA, to take the floor. I don't see you, Mayor, but I am sure that that you are here. The floor is yours for 5 minutes, please. Yes, please.
Okay, thank you. Yes, Emilia, currently in Ghana, we have 1,671 confirmed cases of COVID-19, 188 recoveries, and 16 deaths, unfortunately, from 12 out of the 16 regions of Ghana. And though women contribute 41% of these cases, we still think that more focus and attention should be paid to women, especially at the local level, because the living conditions of the local women have been affected by the pandemic, increasing their vulnerability to the virus. Now, due to the conditions under which the informal women live, they are usually overcrowded and have little or no access to basic amenities such as water, sanitation, good sanitary environments. They are low-income earners and live on a daily meager earnings, laboring either on the streets or in the markets. Now, the outbreak of the COVID-19 has come to make it difficult for the women to engage in their daily economic activities due to the fact that people marketing or for shopping due to the few or the fear of contracting the virus. And these women that depend on their daily incomes are unable to sell to the people that are locked down. On informal and COVID-19 crisis, the disease at the local level, given the fact that not all these women have access to television, radio, and other forms of educational materials. So as REFELA, we took it upon ourselves to reach out to the women at their doorsteps to sensitize them on the spread of the virus, the mode of transmission, and of course, the preventive measures that the women can take. Of the fact that most of the women play a frontline role.
I think we have lost the mayor. The connectivity, there is a connectivity issue clearly. I would ask colleagues at the desk to close the microphone. It's a pity. We will share the presentation with you because this focus on women and particularly the women selling in the markets it's I think very interesting and something that I feel we could all work together around in future work of the alliance as well. So we will share this presentation with you. Thank you very much, Mayor, if you can still hear me. And let us go now to the last speaker of this roundtable, to Caroline Esquina, Director of Urban Research of WIGO. I am certain that WIGO can also provide some inputs on the possibilities that we could explore to support these kind of groups and how this is impacting the informal labor market, which is part of our reality. The floor is yours, Caroline.
Thank you so much, and thank you very much for this opportunity. So I do have 6 quick slides, if we can, great. So just to say, for those who don't know us, Women in Informal Employment Globalizing and Organizing is an NGO, and we have partners across the globe in 63 countries. In addition to researchers like myself, our core members are membership-based organizations. So a lot of this content is kind of bubbling up from the ground. As you all know, the informal economy is the dominant place of work, and there's a big overlap between people working informally and living informally. So the statistics, and there's lovely fine-grained detail at city level, coming out of the ILO and generated by ourselves, is that 61% of all workers, 2 billion workers, are working informally. We are doing a rapid assessment across the globe of what the impacts have been, and it has been devastating, with the vast majority of people losing their livelihoods and currently facing hunger. So, you know, a big call, and we're monitoring the globe in terms of where people are, which countries are responding to this call, is this issue of direct income support, and it's particularly critical over this period. Next slide, please. So I just wanted to pick up on two informal systems, and you know, this is something that's come out quite strongly in the speaker's input so far, is the backbone of many of our cities are based on informal systems. So to pick up on one is the food system. So the research shows that the informal economy, informal producers and distributors play a critical role in food security. And a good place to look for, and I calculated it's research from over 25 cities that is reflected in the African Center for Cities. Really, there's lots of good work that backs up this. So for example, research done across 11 cities in sub-Saharan Africa found 70% of households normally sourced food from informal outlets. Next slide, please. And then we look at another system, the informal waste system. So in many countries, waste pickers supply most, if not the only form of solid waste collection at little or no cost to municipalities. And again, there's detailed evidence on our website. Next slide, please. So you know, our argument in this, and offline, we can go into any details that would be useful to the audience, is a core argument to unlock these systems and the whole system, not just parts of it. So those working in the informal food and waste systems that can and want to should be allowed to work. And many countries have declared this work as an essential service. I'm based in South Africa, and we've worked hard on this, and there's some details about how to do this. That said, it's absolutely critical that it's done in line with safety guidelines. And this implies an urgent provision of appropriate protective equipment, your masks, your gloves, and water and sanitizers. And if sanitizers are difficult to come by, then making our own using bleach. We're also calling to consider health screening at places of work. So just to say, WeGo's worked alongside public health experts to develop detailed health guidelines for waste pickers and informal food traders. So I've just given you one tiny example on the screen. So next slide. But also to say we are monitoring globally what solutions informal economy workers are coming out with themselves. So that, you know, bear in mind, this is a very fleet-footed group of players generally, and we're really seeing some lovely solutions around social distancing, around, you know, making makeshift water points, but they do need the backing of local governments, and really just to walk alongside them and on some of these solutions. And then just finally to say, I was only given 5 minutes and I could have spoken for a long time. So I just did want to say that there is a lot of more fine-grained detail. We are doing a study, a rapid assessment, and now a much more formal one, looking at the impact on informal workers, but also critically policy and organizational responses with a focus on good practice. So it's been amazing. So go to our website. It's been wonderful to have this opportunity to just give you a little taste of some of the work and the tracking that we're doing. So thank you, Emilia.
Thank you very much, and sorry to give you so little time for the very important work that you do and for mapping this. I am even more sorry that we will not have time for a dialogue. I guess we will need to continue that under a different platform. Some of the measures that you have described, I think, are very critical in shifting the way that we perceive things, and declaring some of these groups as essential workers is very important. But even in the global north, and coming from a reality like in my own country, Spain, there is a lot of essential workers that have not gone back to work because we don't have the materials to protect them. So then I can perfectly imagine how that is also a very big problem in the global south. And the production of some of these materials might be also something that we might want to look at, and where those are produced, and the proximity production could be a very interesting way out for some of these groups that could basically support the production of almost anything. So thank you very much for those inputs. And let us now go to our first respondent. I have two. Let me start with the associate professor at the Bartlett Development Planning Unit of UCL, Barbara Lipsig. Barbara, you have some time now to reflect on what you have heard and provide any new inputs that you might want to bring to us. Thank you.
Thank you very much, Emilia. It's been really a very, very interesting discussion so far. I'm sorry we missed more information from our colleague in Ghana, but and also it would have been good to hear more from Caroline, because WIGO has been doing so much interesting work at the moment. So I really invite everybody to go and check out what they've been doing. What's been really interesting for me, and I might be repeating some of the comments that have been done before, but it is the revelation again, or showing again, how much of the current COVID-19 responses or guidelines around hand washing, social distancing, etc., are just impossible to implement in many contexts, and especially in context of informality because of lack of basic infrastructure, high densities, but also, as Caroline highlighted, because they're problematic, highly problematic for those who are whose livelihoods depend on being in the city, inhabiting the city in all its interstices, you know, in all its little places, being on the streets, selling in the markets, on pavements, those who are feeding our cities, facilitating transportation, who are cleaning, recycling, caring for us, basically. And so it's really important to think about alternatives and to go beyond these blanket measures that are still prevalent in many parts of the world. What's interesting about this platform, of course, is not just that they help identify the difficulties and the sticky points, is also that they're helping to highlight some of the positive responses to the crisis. So we've heard some that were really interesting. It was very interesting to hear what the mayor of Banjul had to say around the early responses, working in collaboration with communities, with particular groups of women, with community leaders, religious leaders. Also very interesting to hear again, it's important to bring that to the fore, the fact that community groups themselves are coming up with incredibly elaborate, detailed, nuanced responses which need to be brought to the fore, which need to be fostered. So this is a really important, and I think what's important about a platform like this is putting light, if you want, on these alternatives or these positive response is critical, not just for now, for addressing the crisis, but also because it helps us to envisage what might come next, right? We've been talking about a better, not just a return to normality, but a return to something better. And the two, I think, are intimately related, because we can only envisage ways out of the crisis that are transformative, that really address these long-term structural issues, if we are reading the current crisis as something which, if we're connecting the dot, if we are linking the current repercussion of the crisis to something which is more underlying structural causes, structural vulnerabilities. And I think that's where this kind of discussions are really important. So 2 points, I think, where they're very important. And maybe where we can try and push. One is offering a moment of reflection where we're reframing the crisis around and putting to the fore these underlying causes. I mean, we've heard a lot this notion of, in particular here, how the informality is not just something that is outside, that is invisible, that shouldn't be there, that is going to be overcome, but actually it is constitutive of our cities, and the responses to the crisis need to take that constitutivity, if we can say that word, as a reality. And it means also, not only do we need to see that informality is constitutive to the city, but it's constitutive to the city in a way that is highly unequal across many layers of inequality. And I think some of the inputs today have helped us understand what are some of these layers. They have to do with with gender, for instance. Some of your colleagues mentioned earlier on vulnerable groups like refugees, etc. People who have different kinds of rights, or people who are in the informal economy who simply his jobs are not recognized. So putting this issue of recognition of the informal economy and informal settlements at the core of the city is key. Putting back on the agenda issues of redistribution. We've heard it a lot today, which is really interesting from various mayors and various participants. Redistribution of basic water, sanitation, housing, infrastructure, health provision, education. We didn't hear green spaces, but I know that in Northern context, it is an issue that is being debated a lot, and certainly is also relevant for Southern context. Also the issue of bringing in packages to support lost wages. Also importantly, to take a gendered, as I said, diversity lens. Now, it's really important I know, Emilia, you said that we are speaking to the converted in a way, like we're all in agreement, but it's okay that we should reinforce that. And maybe what we should do rather is try to see how can we bring in more people into this conversation, because let's not forget that there is a very strong concurrent push at the moment to use this moment of crisis as a moment of exceptionalism, but that the exceptionalism can become the norm. So deregulations of labor standards, environmental standards, undoing some of these careful, which normally take a lot of time, these careful engagement between communities and local government, which can be very easily swiped off in a moment of crisis. So it is really important that there is platforms like these to reinforce this reading of the crisis. Secondly, what's really interesting here is this talk of collaborative, that we can only find solutions through collaborative responses. And this is really important given the crisis that we're dealing with. And I think the webinars give us a very interesting approach in the ways in which we could be dealing with that. Because we are here on the same platform, at the same level. We have mayors, we have had a minister, we have representative of informal community groups. And whilst there has been these kinds of practices in many of the fora, like World Urban Forums, like many of the UN Habitat organized organizations, the fact that these webinars are taking place in a very close proximity, maybe it is about also to do with the technology that everybody is arriving at the same time, arriving on the same moment. There's something very refreshing about that. And I think something that we might want to think about for long-term sort of building on these approaches. And just to finish that, maybe on this point, is how can we try and stretch the experiences that we have in the webinars for thinking different kinds of governance and different kinds of approaches to dealing with informality in the future. Maybe thinking about inviting more people around the table, a diversity of actors around the table. I heard some of the speakers today speak, for instance, about the private sector. Some talked about religious leaders. We need to understand where and who are the people that have weight, and how do we bring them into this conversation? And perhaps also the story of bringing these kinds of webinar debates into local levels, that they can become a model for thinking through collaborative platforms at citywide level. So thank you very much for the very interesting discussion so far.
Thank you very much, Barbara. And certainly, if it is up to us, the live learning experiences are just the first pillar of a process of collective learning. And it will need different steps. There is a political steps in terms of policy recommendations, and we will necessarily, as alliance, we will need to look also for some concrete actions that are inspired in this new reality, and some of the sharing that we have been doing here. I'm totally convinced that gives us a very important opportunity as well. It is also, I think, very, very important to share that while we are all sharing very similar opinions and we're hearing similar challenges, only 3 years ago, this was not so much the case. And only 3 years ago, this group, which is now still 180 people, 2 hours later, was even more reduced. And so I think we need to acknowledge progress and also take responsibility to to transform this into concrete action. And speaking of concrete action, I would like to invite the president of the Task Force on Sustainable Cities of MEDEF International, and also an advisor on sustainable cities to the French Ministry of Foreign Affairs. Gerard, the floor is yours.
Thank you, Emilia, and thank you everybody for this brilliant session. It's the second one for me, and it's very interesting. Just a word about MEDEF, which is the private sector. And Barbara was just saying that you should have more interaction with the private sector. I'm from the private sector. I'm French. I'll make it my short speech in English, but I'm happy to say that we're working with a lot of colleagues from other countries. This gives the opportunity to say that since 2 months that we are now all facing 2 or 3 months, this horrible pandemic, everywhere in the world, business people, French or from any other nationality, tells us that they are staying in the country where they are expats to be sure that they can continue what we call the essential services. And whether we speak with colleagues, business people, or whether we speak with mayors, and today again we had a lot of point of view of mayors on this thing, it is quite clear that we have four essential services that have to be not only implemented, but also more and more, I would say, pushed in informalities, talking about water and sanitation first, and Secretary General of UN Habitat that we met in Abu Dhabi said how important was water and sanitation. Number 2 is waste management. Number 3, nobody talked about today, we talked about last week, is electricity and access to energy. Because if you have no electricity, you have no possibility to have a hospital or any kind of a sanitary. And number 4 is urban transportation. And I would just like, in the time I have, to say that in particular in informalities, things that we've done in South Africa, for instance, in Khayelitsha or Cape Town, or that we've done in Colombia with the mayor of Medellin to have people going to favelas over there, is to have this urban transportation to be sure that people can go to find some work, because as it was said earlier, we know that more than 60% of workers are informal workers, and we have to do things everywhere on all the continents to be sure that we can have on transportation, on electricity, on water, and on waste management, everything we need. And in the time which is still okay for me, I just want to say, how do we act? We've launched this French initiative on essential services, which is a coalition of private sector, of course, but also of NGOs, but also of ministries, but also of local governments. And I'm happy to see that my good friend Jean-Pierre Elong-Bassi is on board today. We've done a lot of things with mayors and local governments in Africa, but also everywhere else. And we consider that we have to provide more solutions on this 4 essential service in this coalition with French NGOs, with French local governments. And we want to do 2 things, a part of providing global solutions. We want to train people, because at the beginning, William Cobbett said, we need local skills. He's right. If we don't have local skills, we go nowhere. So it's not only providing solution, it's not only finding, let's say, electricity plants or sanitation plants. It's also about training the local people, because not going to operate that with French guys. And the second question is boosting financial solution. We talked about PPP, Steve talked about PPP. We have to put on board, I think, more IFIs, it's not normal that World Bank and Development Bank of all the regions in the world do not already boost a specific program on essential services. If we don't go with these 4 essential services, we'll go nowhere. And for me, it's one of the lessons of this type of webinar to go further on. I'm out of my time in 20 seconds, so I just want to say that I presented this just to say that the private sector is in, that we are happy to help, and we are on top of that, happy to partner with anybody around the world, because we want to try to be part of the solution on a global situation. Thank you.
Thank you very much, Gerard. Thank you for bringing in this private sector perspective. The conversation between the private and the public is something that we have been working on for a long time with many of our colleagues. One of the difficulties of this kind of gatherings is that I know there is very important and very relevant people following this conversation, and I am not able to give them the floor. One of them is the Vice Mayor of Toulouse. Thank you very much for being with us, but there are many, many, many others. We are going to start the wrap-up, and I am going to give the floor after these very diverse presentations tackling different aspects. I would like to give the floor to Same Wava. He is the Global Director for the World Bank Urban and Disaster Risk Management, Resilience and Land Global Practice. It's a very long title, Same. But you have a short name and a very good friendship with us. The floor is yours for the wrap-up.
Thanks a lot, Emilia, and good morning, good afternoon, good evening to everyone, wherever you are. So obviously, I mean, at the World Bank, we are really doubling down and scaling up all our efforts. Our president has announced that the World Bank will put as much as 160 billion over the coming 15 months. And this is basically an acceleration of IDA funding, IBRD, and additional resources in order to cope with this unprecedented crisis. There are 4 different pillars for this intervention. The first, of course, is the public health emergency. I mean, it's all the funding and the liquidity that's going to support surges in medical capacity and PPE and ventilators and dealing with the medical crisis. The second is obviously the global economic stimulus, much of which, of course, will be naturally implemented by the entities that are closest to the clients. And then 2 particular areas of focus. One is, of course, the poor and the vulnerable, who are the worst hit with this crisis, and the other is the private sector. We're right now focusing and working on the package of interventions that are needed for the poor and the vulnerable. So to explain, my global practice, despite the long name, has done some really interesting work in terms of predicting the hotspots for virus transmission. So what we're doing is through high resolution satellite imagery and the ability to construct very rapidly the city in 3-dimensional form. When you take population density against this built environment, you can basically identify the areas where social distancing would be impractical in terms of maintaining those distances of 2 meters, and then working on the ground with community-based organizations like Shack Dwellers International and Slum Dwellers International. You can identify also the situation of infrastructure, such as communal water fountains and public toilets, etc., that are places also of increased contagion risk. And with this, you can basically do a quick mapping that can identify for a city the places where the virus might transmit more likely than others, so that cities with scarce resources may want to focus their resources on flattening the curve in there. So we're scaling up to work on this. Of course, our poverty global practice has done quite a bit of analytics on the basis of losses of income, of livelihoods, to try to identify what could be the scale and the magnitude of the challenge we're dealing with. We're talking about something in the range of 100, if not more, million new poor. So people on account of job losses, of livelihoods interrupted, are likely to fall into poverty. So right now we're putting together basically the mechanisms that could help scale up support to the poor and the vulnerable. Of course, there's all the work, all the social safety nets, social protection mechanisms, if you will, anything from the instruments a la Bolsa Familia, a la Oportunidades, all the conditional cash transfers, basically mechanisms that provide support to the poor and the vulnerable that are in place. And where you don't have the infrastructure to identify the people that are the poor and the vulnerable, we're obviously leveraging place-based approaches, so basically targeting informal settlements, slums, and places where concentrations of those who work in the informal sector, who have income and other types of vulnerabilities, disabilities, etc., who would need the type of support. And then obviously we're discussing with WeGo and other entities. We had a brainstorming with Marty Chen the other day about how we can also help scale up targeting mechanisms for informal workers. So I think this is what we're doing at this stage. We're identifying all the platforms that we have in place: slum upgrading projects, urban community-driven development projects, local government operations, municipal infrastructure, and the types of interventions that could put in place block grants to communities, channel safety nets for the poor and the vulnerable, and put in place the type of labor-intensive public works that could help create jobs and could help jumpstart this early recovery. I mean, we have programs like in Indonesia, in Ethiopia, an urban local government support program that invests significantly in labor-intensive public works. And out there, out of every dollar spent on infrastructure like cobblestones, etc., 50% and more accrue to the community members. We've got, existing programs in places like Indonesia and many other countries that are active and could be used to channel the resources, because right now, obviously, speed and expediency and scale are of the essence, and therefore tried and tested mechanisms, of course, that could be adapted, because it's not, that a normal infrastructure project will continue doing what it does in every day. I mean, but adapting these infrastructures to work with social enterprises for the distribution, for instance, of food, of cash to households, awareness campaigns, and otherwise. The other day, we were talking to our counterparts in Argentina, where we have a large slum upgrading program, including in Bairro 31, and there's a major scaling up of these intervention, covering issues of communication, caring of at-risk population, early detection, mitigating the socioeconomic impact, sustaining essential work and livelihoods, and obviously the partnerships that are needed with community-based organizations, with NGOs, with social enterprises and the private sector for this delivery. It is, again, an unprecedented crisis, and obviously we all need to come together, as the previous speakers have mentioned. But also the crisis has made it clear that there are inequalities on the ground, and there are inequities in terms of service delivery, in terms of vulnerability, economic vulnerability, and otherwise, that need to be addressed. And obviously, the work that we're putting in place right now is meant to address both that immediate response, the emergency response, but also starting to prepare for what is this new normal in cities. Over to you, Emilia. Thank you.
Thank you very much, Same, and I hope that that beyond the very important programs that you're bringing about, we can start to introduce this some innovation and convince the member states of the World Bank also to do different types of investment there. But as you are saying, we need to react very rapidly now, and I think helping those that are most vulnerable getting out of this first stage of the crisis is very significant. Thank you for sharing those examples, and we'll make sure that we share some of those resources in our Beyond the Outbreak page, and also Cities for Global Health is a very good reference for the local and regional government cases. I just wanted to remind you of that. Adriana, the perspective of civil society into as a wrap up as well. President of Habitat International Coalition. Sorry, Adriana.
Thank you so much. And again, the first thing is to say a very big thanks to Emilia and everyone else at UCLG for being so strategic and brave and bold in crafting and nurturing this crucial space, this crucial community that is clearly inviting us to think and do things in a different way. So I just want to highlight three things to start and three things to end. So you will be happy to feel that you're closer to the end. To start with, the first three things I suppose have to do with, again, reminding us what is the conversation that we have been having about. And for me, there are three things that are important I take away. The first one is to remember that we are not talking about a pop-up crisis, we are not talking about a new unique crisis, we are talking about, for some of us, I'm sitting in London, you know, and perhaps here is a unique crisis, exceptional crisis and so on. For most of the people that we're talking about on behalf of, this is a crisis within multiple everyday crises, and that will be faced now and beyond that. So we have to remind ourselves of that exceptional condition that we attribute to this crisis is a non-exceptional condition in which people living in informal settlements and working in the informal sector live all the time. So it's quite important to insist that, not a pop-up crisis, a crisis that we could see coming and we have to prevent in the future because we will face similar ones, because it's absolutely rooted in pre-existing inequalities. The second condition that is also important, I think, to remind ourselves is that perhaps we talk less about that. What do we talk about when we talk about informality? We talk about informality today a bit like something that is out there. And I think that, again, it's very important to remind ourselves that what we call informality, informal settlements, informal workers, and so on, are absolutely essential for the functioning and the working of what we call the formal city. Without the informal sector, without the, you don't have the reserve labor force, house, and so on, that does a lot of the managing, giving life, running cities on an everyday basis. So in a way, it's not about doing something good for others, but it's about us. The two systems work together. They are not separated, and we do need to think about that. Otherwise, we treat this as a subsector of the cities, as a subsector of economy, and that's perhaps where we tend sometimes to struggle. The third point I think that is very important is to go back to Emilia's invitation at the beginning. As important as it is to celebrate what we are doing well, it's also so important not to be self-complacent. Wherever we work, to keep on pushing and asking ourselves, why do we keep on talking sometimes about the same targets, the same objectives, and we don't get there? And I think that now, to move to the three final points, I think that there are three things that are important perhaps to remember in relation to what is that we could not only talk about differently, but also do differently. The first thing is clearly has to do with what Barbara mentioned before, as to really put in motion some form of redistribution. Change will not come unless there is a redistribution of the resources that are managed by the private sector, through communities, by local governments, and so on. And a very important aspect that was highlighted by many on the chat was, well, but actually, how much do we know about how many people are in this condition and that condition and so on? Well, we had two key reminders throughout the whole debate. One was, remember that one fourth of the global urban population live in the so-called slums or informal settlements, and 2 billion people work in the informal economy, not only in the global south, here in London, there in Barcelona, yeah, in the global north too. So we know about these big numbers, but when we go to a city, we zoom to a city, very often you ask a mayor, you ask officers and so on, and these numbers become very tenuous. However, those living and working in the informal economy have those numbers, produce data, and we have to engage with that data, and we have to recognize that that data is legitimate, is valid, is fundamental to plan with. So we cannot come and bring scientists and experts and so on to produce new data. We have to work with the data that is already being generated on a daily basis. This is something that we know about, the self-enumeration process, the self-mapping process, and so on. The second point has to do with recognition. So we talk a lot today, and it was fantastic to hear so many references to gender, to the very different conditions and experiences that women and men, girls and boys face. But we have to also remember about, it's not only about talking about those differences, it's about targeting social protection measures differently. What we need to do, my work for men in informal settlements and not for women, my work for migrants and not for, for my work for all settlers and not for newcomers. A lot of what we talk about, and someone always falling through the net, are tenants. We are hearing a lot about rental holidays and so on, things that might work within the formal economy. But what do we say about those who are tenants? A very high percentage of people living in informal settlements are tenants. How are we going to help them? Usually Islam, not help them, how are we going to act upon the reality? Islam upgrading usually doesn't do anything for them. Yeah? Just does things that increase the rent. So we need to really be bold about those realities. The last point is about seeking parity of participation. We are talking a lot about needs, and of course it makes sense because we're talking about a crisis, but I love when someone, our colleague from Costa Rica, said we need to use also the long lights, yeah? The long distance lights, las luces largas. And I would say that we need to use both, the short and the long distance lights. And that means that one of the key things is that one of the key problems, or one of the key areas where we keep on failing, is on the fact that we talk about addressing needs, particularly in times of crisis. But we need to, again, address rights. We need to entitle rights. We need to activate rights, not talk about rights, not talk about human rights, about something that, you know, is to be, dealt with in an abstract way. It's simply about activating rights, activating the entitlements for people, those that sometimes are treated as the others, to really become part of us. And I think that, just to finalize, local and regional governments have a unique and an extraordinarily important role to play in all this. It's extraordinarily amazing, it's extraordinarily good to see that local authorities are here in this platform, not just considering themselves as someone that, you know, that's something to do with public, you know, street cleaning, solid waste management, and so on, but with these very essential issues of producing cities, of producing urban life, and now, as we know, of producing also health. Thank you so much.
Thank you very much. Thank you very much, Adriana, for this call to partnership and for these strategic steps to take into account to transform talk into action. And I would like to invite you to look at the decalogue that we have developed. We need to develop the headings, under the headings, the different steps to undertake, and we would really welcome your inputs. They are open until the end of the month. And many of these aspects are also going to be related, some of the solution, with local economic development, how we think about it, and how do we insert the informal economy into that model of local economic development. And we will be talking about that tomorrow in the live learning experience on local economic development. So now an institutional view from UN Habitat, and I understand that it will be my colleague Philippe Decourt that will provide those closing remarks. Philippe.
Thank you, Emilia, and thanks to you and UCLG and all involved. I would like to be able to put the volume up on this press release coming out on this. I think we really need to put it as high as possible, because, and maybe I'll focus on two key calls which should be echoed outside this group as loud as possible. One short term, one long term. Short term, we have to scale the call for immediate action. We have not seen the worst yet, and preparedness is key, as also the mayor of Freetown has clearly said. We need to make sure ensure community ownership. It requires visibility and giving voice to communities in informal settlements and slums. We need to scale resources and capacities directly to local governments and communities so that they can lead the immediate response and build resilience now, not later. We also make sure it will require that this is part of global and national response, but allowing it to be tailored to the local realities. But on the UN Habitat side, we've been pushing within the UN, and we are happy to note that within the UN Global Response Framework, it is captured, but now we need to translate it into a quick mobilization. There are practical sets of guidance on informal settlements and good practices out there. We are happy that we're working on a practical planning tool to help now translate this into action and reprogram what we have. We are doing it ourselves with our participatory slum upgrading program, but we need to do it across the board, reprogram the resources we have today. Long term, it has been said, we cannot waste this crisis. It is time to sustain progressive efforts, shift gears, and have a bigger narrative. Mobilize everyone, anywhere, as part of the decade of action to leave no place behind. This is heavy lifting. The systemic vulnerabilities are real and very clear. It's not just about the exposure by COVID, but also by climate impact. Let's not forget about the other big risks to these communities going forward. It has been said, we need to consider all citizens equal. We need to plan holistically across formal and informal parts of the city and ensure, and it's not easy, access to affordable land and adequate housing. It will require a much broader and stronger coalition to drive longer-term sustained change. We cannot just work in our own corner. We'll need to build that coalition going forward. We have the new urban agenda, we have the SDGs. We need to mobilize national and local governments, anyone who can help, but also financing. And there, I think we need to make choices in the development models we have. It's not just about fixing markets, but really putting the SDGs front and center and making sure all investments, public and private, have impact, the impact we need. So, of course, UN Habitat, we will do our part. We will adjust also the flagship programs we launched at the World Urban Forum, but happily to be part and engage in this going forward. Thank you, Emilia.
Thank you very much, Philippe. And I would like to share my 4 minutes with colleagues from the Global Task Force that are here. We had a meeting of over 20 organizations of local and regional governments to share experiences on what we were doing during COVID, but how we were looking at the after COVID, our role. And I would just like to invite Greg and Jean-Pierre along Embassy to give us really in those 2 minutes, have you been inspired, and do you think that we need to shift things in the way we are doing things at the network? What are we missing? Because really, I think at this point in time, there is this moment of opportunity that we need to take with both hands. And if we don't do it, it's simply because we haven't been creative enough. So 2 minutes for you and 2 minutes for you, Jean-Pierre, and then we say goodbye and thank you, UN Habitat, for the support that you are giving to this thinking process. Greg, you start.
Great, thanks, Emilia. I just think this has been a really good session for a number of reasons. It's giving us an opportunity to rethink our advocacy and our approach. You know, we talk about informal settlements as being out there, and I think someone said it just now that, you know, the two systems are codependent, and we need to work that into our narrative. We need to work that into all of our actions, that the informal sector and the formal sector are codependent. And you're quite right, it's here in London as well. It's not just in the global south. So I think sessions like this and the COVID pandemic, it needs to influence our advocacy and our work and our messaging. I mean, we can't, I've always said, and you've heard me many, many times say, if what we are doing is not directly benefiting a community, then we shouldn't be doing it. And that has never been more real and more necessary than at this precise moment.
Thank you very much, Greg. I knew I could count on you for the timing and for the sharp messages. Really looking forward to shaping that thinking process into action. Jean-Pierre.
for the session. It was very interesting. I learned a lot, and I saw that we share, all of us. Maybe we're talking among ourselves, but it's good that a community is established around this common understanding that informal is not informal. Informal people are part of us. And you can't be inclusive by shying away from consideration of all these people that form the city, are embedded in the city and make the city function. What I want to highlight is that we talk, but let's act. Because people are out there having serious problems. And we want that the social pact that we are all calling for in the midst of this crisis enable us to have different lenses on the way we are going to address these issues beyond talks. So the immediate action, Emilia, is to call for support, global support, like the one we did for the tsunami. Remember that our community of local government act to support these people that have nothing to eat, nothing to pay their rent, nothing. We need support. And among our community first, and also by calling for others to come and support. And we need a conduit towards these very people, not bureaucracy and money divided into secretariats and so on. No, we want to go to target these people. And we have technicalities that can allow us to do that. The blockchain techniques can allow us to follow this and to get to the people. In the long term.
1 minute to go. Yeah, Pierre.
In the long term, we need to change the way we do business. I know that many people are saying partnership, but partnership for who? Because for me, we were working in partnership, but it was directed for the winners of the partnership. Can we change the partnership to be equal partnership? And if we say equal, it means change of model of the economy. Thank you.
So thank you, Jean-Pierre, for leaving us with that challenge. And I am taking your call and referring to this call that we are making for a recovery package. For redirecting the funding for international cooperation. Please, 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 international cooperation is still very, very important. And I am sure that UN Habitat is also putting that message through to the member states. So we'll continue with that. Colleagues, end of the session. Thank you very much for this incredible learning experience for all of us, but also for opening up these paths for better work. Thank you, Cities Alliance, as a trusted alliance, as trusted partner. Thank you all, colleagues. See you soon. See you tomorrow, in fact. Many
tomorrow,
of you.
Yes.
Thank you.
Thank you.
Local economic development. Thank you very much. Please be calm, be healthy, and be creative.